I think medicine is a pathway for whatever you want to do in life. You can do anything you want to do. If you want to teach, you can do that in medicine. If you want to work with your hands and really dive in, you can do that as well. If you just want to be there for people through those difficult times and talk them through it, you can do that as well. Whatever pathway you want to go, medicine is a vehicle for you to get there.
I became interested in medicine pretty early on. I'm not quite sure if I knew exactly what that meant at the time, but I think when I was about 4 or 5 years old, I had already told my mom that I was going to medical school. Then I think it truly became more of a possibility for me after 7th grade. My grandmother suffered a stroke, and I ended up being a caregiver for her for the summer. And I really started to think of a career in medicine as more of a reality rather than a dream.
My name is Justin Bailey. I am a graduate of the UAB School of Medicine, and I am currently a pediatric resident at UAB. So I always wanted to be involved in the children's lives in my community. I always admired my teachers growing up. I taught for a little bit after college myself, and going into med school, I knew that that's where I wanted to be, and I wanted to do that in the city of Birmingham. So going into pediatrics as a resident, I'm looking for opportunities to get out of the hospital into the communities that I grew up in so I can serve the city as a whole.
Hi, I'm Dr. Vincent Michael Bivens, and I grew up in a small town in Pike County, Alabama called Brundage, Alabama, which has a population of around 2,500 people. Where I grew up, we did not have a physician. We actually had a physician assistant. So I didn't see a lot of physicians. I didn't at the time understand what it took to become a physician, what studies I needed to do to prepare myself to become a physician. And it wasn't until I got to college that I had a chance to meet a physician that took me under his wing. And I got a chance to see what his life was like. I got a chance to see how he impacted people. I got a chance to see how people responded to him. I really liked the fact that people gave him respect. I mean, whenever he would walk in a room, it was just like if all eyes were just drawn to him. And so I think that was my initial sort of attraction to becoming a physician.
One obstacle I really ran into when I decided to pursue medicine is that I was already, older than the average pre-medical student, and I had no idea how to get there. There were kids that were younger than me that were already flying through classes, and I was often the oldest one in my class, and not really knowing, is this for me? Should I be doing this? Should I be starting from square one? But when I hit those times, I just really focused in on why I was doing this. I remembered my childhood teachers and my pediatrician, who was that figure that guided me to this point. And I realized I wanted to be that figure for someone.
In family medicine, you have to be a jack of all trades. You have to be the emergency doctor, the specialist, the primary care doctor, any and everything that could happen in medicine, you will get a little taste of it in family medicine. I try to be very personable and open with my patients. I feel like my patients are part of my family now. By developing these relationships with my patients, they know that I truly have their best interest at heart, and they are more willing to open up to me about things. And that makes it easier for me to better take care of them, because truly it's a partnership between us. When I was growing up, the nearest doctor's office was about 20 to 30 miles away. It's hard to imagine someone being in an emergency situation medically, and the closest place that they can get to is like 30 miles away, which is why in rural areas there's such a disparity of health, because they just can't get to the care that they need. That was another thing that kind of always pushed me towards primary care, because I wanted to be one of those doctors that was right there in the community, readily available to give the care that the patients needed.
If we improve the health of those who are underserved, we will improve the health for everybody. And I think we need to understand that the populations in our state that have poor health have an impact on the health of everybody if we can improve their overall health status. Secondly, we know that the best outcomes for improving health and taking care of patients is if people who they know, who they trust, and who often look like them are able to participate in their healthcare delivery.
When I talk to young people, the advice I want to tell them from that is, you can do this. And not only can you do this, you can be great at it. We need young people to get interested in math and science and get interested in medicine. This is a wonderful life. Having this coat on, wearing this, it's a wonderful life. I get to talk to people. They tell me their secrets. They tell me what's bothering them. They put it all on the line. And then I'm able to help them. And when I go home every day, oh man, I feel so wonderful knowing that I helped somebody.
If you're a junior high or high school student and you have even the smallest dream of going into medicine or healthcare, I think practically speaking, the first thing that you should really start to do is start to build relationships with people that can help you get there.
Your teacher and your parents are your greatest asset, and have them know that you want to do everything possible to be your best. And in my experience, that no teacher turns that down. They embrace that. And then if you ask your principal, your guidance counselor the same thing, they will go to bat for you. They will speak to those and say, who have areas of influence and exposure, and say, I have a student who I am convinced is going to do something special.
If there's anyone that you know that's a doctor, a nurse, a pharmacist, a physical therapist, try to start building a relationship with them. Go to them, ask them if it's possible to spend a little time with them when they're working so that you can see what they do. A lot of people will be very receptive to this, and you would be surprised at what all you could get to do. You may find that you may end up getting a job there for the summer where you are actually getting to play a part in what they do. And I think any and all experience that you can get early on will make it a lot easier to decide if this is something that you truly want to do. And you'll likely be building relationships with people that can help you along the way.
Coming from a rural, small town, Alabama town, I was always faced with this one question, or two questions rather. Am I good enough and do I belong? And I think a lot of young African Americans in particular have those same questions.
Some of the most rewarding things for me in medicine is walking into the door of another Black family and seeing their face light up when they realize that I am their doctor. I really think that's important in our communities for our patients to feel that sense of safety and that sense of trust with the people that are coming into the rooms to take care of them.
It doesn't matter where you come from. It doesn't matter who your parents are. It doesn't matter if you had less than others growing up. You have what it takes to be a doctor, to be anything that you want to be, and we want to help.